by Dr. Ezekiel Emanuel and his Complete Lives System. As many of you know, Dr. Emanuel is the brother of White House Chief of Staff Rahm Emanuel. He is a bioethicist and one of those special advisors to the president. Perhaps he could actually be the rationing czar. Dr. Emanuel has published some very disturbing ideas on how to ration care, which can be summed up by this Brave New World humpback whale graph that we have here, along with aging groups of the population. Dr. Emanuel's Complete Lives System, something that sounds a little bit like a cure-all elixir sold out of Del Rio, Texas, basically works off the premise that the older you are, the more you've lived, and therefore the less you deserve in health care. I'd like to point out that the average age of a U.S. Senator is 62. Just something for all of you to think about as you look where the money is available for health care under the Complete Lives System, which is the blueprint for the bill that we are considering. 10 years old, you're doing pretty good right here. 20 years old, that's when you think you're bulletproof and you don't want insurance, but you've got a lot under this plan. 30, you're in pretty good shape. 40, here comes the roller coaster. 50, you're in trouble. 60, you might as well forget it. 70, well, you're off the chart. So basically, President Obama has clearly listened to Dr. Emanuel's counsel, if you remember his observation in an interview this summer, that as patients get closer to the end of their life, maybe you're better off not having the surgery, but taking shots and painkillers instead. I consider that statement to be unbelievable. Well, as someone who falls towards the end of Dr. Emanuel's bell curve here, right over there, this type of thinking is just unbelievable. Tell someone they cannot have a knee replacement because they're too old. How old is too old, according to Dr. Emanuel? The Wall Street Journal reported on the age rationing that occurs in Canada. In that country, apparently 57 is too old for a hip replacement or hip surgery. Perhaps they can drive south and find care right here in the U.S., but I'm not sure they will go if this bill passes.